Clinical Decision Support Systems. Clinical Decision Support Systems, CDSS, are advanced technologies that assist healthcare professionals in making clinical decisions by providing data-driven insights. These systems are designed to enhance decision-making in clinical practice by integrating patient data with medical knowledge and providing actionable recommendations. CDSS can help clinicians diagnose conditions, plan treatments, and monitor patient progress more efficiently and accurately. What is CDSS? An overview of clinical decision support. A clinical decision support system, CDSS, is a computerized tool that helps healthcare providers make informed clinical decisions by analyzing medical data. CDSS typically uses patient information, such as medical history, symptoms, lab results, and diagnostic imaging, to offer suggestions, warnings, or recommendations. The goal is to improve patient outcomes by providing evidence-based support at the point of care, assisting with complex decision-making tasks, and reducing human errors. CDSS can take various forms, such as 1. Standalone software, operates independently within a healthcare setting. 2. Integrated system, embedded within electronic health records, EHR systems, facilitating seamless use by clinicians. The role of CDSS in modern healthcare. In modern healthcare, the role of CDSS has expanded significantly, driven by advancements in technology, data science, and the availability of vast amounts of health data. Key roles of CDSS include 1. Improved clinical outcomes. By providing real-time, evidence-based recommendations, CDSS helps clinicians make informed decisions, reducing the risk of errors and improving patient outcomes. 2. Clinical efficiency. CDSS aids in streamlining clinical workflows, reducing the time spent on manual decision-making and allowing healthcare providers to focus more on patient care. 3. Personalized medicine. CDSS can help tailor treatments to individual patients based on their unique medical history, genetics, and other factors, supporting the growth of precision medicine. 4. Alerts and reminders. CDSS can issue alerts about potential medication interactions, allergies, abnormal lab results, or preventative care reminders, preventing avoidable complications. 5. Reducing costs. By enhancing clinical decision-making and reducing unnecessary procedures or medications, CDSS can help lower healthcare costs. Key components of a CDSS: data, algorithms, and user interfaces. A well-functioning CDSS relies on 3 primary components. 1. Data. The foundation of any CDSS is high-quality, accurate, and comprehensive data. This includes patient-specific data, e.g. demographics, medical history, laboratory test results, and diagnostic imaging, as well as broader clinical knowledge, e.g. clinical guidelines, best practices, and research findings. This data is typically pulled from electronic health records (EHR) or other clinical databases, allowing the system to analyze patient data and provide personalized recommendations. 2. Algorithms. Algorithms are the brains of CDSS. These are predefined or machine learning-driven models that process the data and generate recommendations. They may include rules-based systems, statistical models, or more advanced artificial intelligence (AI) methods. The algorithms analyze patterns in the data to suggest diagnoses, treatment plans, or even predict patient outcomes. The effectiveness of these algorithms depends on the quality of data and the clinical rules they are based on. 3. User interfaces (UI). The user interface is crucial to the successful implementation of CDSS in clinical practice. A well-designed UI allows clinicians to interact seamlessly with the system. It should present information clearly, be easy to navigate, and integrate smoothly into the clinician's workflow without causing disruption. UIs might include dashboards, pop-up alerts, decision trees, or other visual tools that help users quickly interpret the system's recommendations. Together, these components enable CDSS to deliver real-time, context-aware support to healthcare professionals, ultimately improving decision-making processes and patient care. Types of Clinical Decision Support Systems, CDSS. Clinical Decision Support Systems, CDSS, are diverse and can be classified into various types based on different criteria, such as whether they rely on medical knowledge or data-driven approaches, or whether they provide active or passive support. Below are the key types of CDSS, knowledge-based versus non-knowledge-based systems. 1. Knowledge-based CDSS. These systems rely on a vast repository of predefined medical knowledge, including clinical guidelines, rules, and expert systems. They provide decision support based on the analysis of patient data against these predefined knowledge sources. The system's algorithms are built using expert knowledge or rule-based reasoning, e.g., if-then rules, which enables the system to suggest diagnoses, treatments, or preventive measures. Example: a knowledge-based system may alert a clinician to a potential drug interaction based on known pharmacological interactions. Advantages: provides evidence-based recommendations grounded in established medical knowledge, can be tailored to specific medical specialties, e.g. oncology, cardiology. 3. Disadvantages: may require frequent updates to remain relevant with the latest clinical guidelines, can be limited by the scope of the knowledge base and rules. 4. Non-knowledge-based CDSS. These systems primarily rely on data-driven approaches and do not depend on predefined rules or knowledge bases. Instead, they use machine learning, pattern recognition, and statistical models to analyze patient data and generate predictions or suggestions. They tend to learn from large data sets, such as electronic health records, medical imaging, and other clinical data sources, to identify patterns and relationships that may not be explicitly codified in medical knowledge. Example: a non-knowledge-based system may predict a patient's risk for developing a certain condition based on patterns identified from similar patient data. 5. Advantages: capable of uncovering complex relationships and making predictions that might not be evident through traditional rule-based approaches, can adapt and improve over time as more data becomes available. 6. Disadvantages: often requires large amounts of high-quality data to function effectively, can be challenging to interpret as they may not provide clear reasons for specific recommendations. Active versus passive CDSS. When and how they are used. Active CDSS. These systems actively intervene in clinical workflows by providing real-time recommendations, alerts, or reminders as the clinician is making decisions or performing tasks. They can trigger alerts about potential problems, such as abnormal lab results, medication interactions, or deviations from clinical guidelines, as soon as the relevant data is entered or updated. Example: a system that alerts a clinician when a patient is prescribed a medication that conflicts with another drug the patient is taking. Advantages: provides timely, actionable information that helps prevent errors or omissions in patient care, can improve adherence to clinical guidelines and enhance patient safety. 3. Disadvantages: may lead to alert fatigue if alerts are frequent or not relevant, potentially causing clinicians to overlook important warnings. Needs to be carefully managed to avoid overwhelming healthcare professionals with too many alerts. 4. Passive CDSS. Passive systems do not actively intervene in the decision-making process, but instead provide decision support upon request or in a non-intrusive manner. They may generate reports, summaries, or suggestions that are available when the clinician chooses to access them, but they do not interrupt or prompt immediate action. Example: a system that allows a clinician to search for evidence-based treatment guidelines or look up patient information at their discretion. 5. Advantages: does not disrupt the clinician's workflow allowing for a more personalized and flexible approach to decision-making, may be less likely to contribute to alert fatigue. Disadvantages: might not be as effective at preventing errors or improving patient safety compared to active systems. Clinicians may not always access the system or consider its recommendations when needed. Examples of common CDSS applications. 1. Diagnostic assistance. CDSS can assist clinicians in diagnosing conditions by analyzing patient symptoms, medical history, and test results. These systems compare the clinical data against known medical knowledge or patterns in patient data to suggest possible diagnoses. Example: a CDSS that helps doctors differentiate between various types of infections based on symptoms, lab results, and patient demographics. Alerts. CDSS can issue alerts related to potential risks, such as drug interactions, allergies, or abnormal lab results. Alerts are typically triggered in real time during patient care activities and can help prevent harmful events before they occur. Example: an alert warning about a possible adverse reaction when a patient is prescribed a new medication that conflicts with their existing medication regimen. Treatment recommendations. Based on clinical guidelines, patient data, and best practices, CDSS can suggest treatment options tailored to the individual patient's needs, improving treatment decisions and outcomes. Example: a CDSS recommending the most appropriate chemotherapy regimen for a cancer patient based on their genetic profile, cancer stage, and other factors. By integrating CDSS effectively into clinical practice, healthcare providers can significantly enhance patient care, improve clinical decision-making, and streamline workflows. The technology behind Clinical Decision Support Systems, CDSS. The technology underlying Clinical Decision Support Systems, CDSS, is a combination of data management, algorithmic analysis, and system integration. These components work together to provide clinicians with real-time, evidence-based decision-making support. Below is an overview of the key technological aspects of CDSS. 1. Electronic Health Records, EHRs. EHRs are one of the primary sources of data for CDSS. These digital records contain comprehensive, up-to-date information on a patient's medical history, diagnoses, treatment plans, medications, allergies, lab results, and other relevant health information. CDSS pulls data from EHRs to analyze a patient's current condition, assess risks, and generate recommendations based on up-to-date medical knowledge and clinical guidelines. The quality and completeness of EHR data are crucial for CDSS effectiveness. Missing or inaccurate data in the EHR can lead to faulty recommendations. 2. Lab results. Laboratory test results are another key source of data for CDSS. These include blood tests, imaging results, genetic testing, microbiology reports, and other diagnostic findings. CDSS can analyze lab results to detect abnormal values, flag potential health risks, or recommend further testing or treatment options. Example: a system might flag a dangerously low sodium level or an abnormal glucose level in a diabetic patient's lab report, triggering alerts or suggesting corrective action. 3. Patient history. Patient history includes both medical and personal information that provides context for decision-making, such as previous conditions, surgeries, medication history, allergies, family health history, and lifestyle factors, e.g., smoking, diet, exercise. CDSS can use patient history to personalize recommendations, ensuring that the decision support is relevant to the individual patient's specific circumstances. Algorithms and clinical guidelines. The backbone of CDSS decision-making. 1. Algorithms. Algorithms form the computational core of CDSS. They process and analyze the input data, from EHRs, lab results, and patient history, to generate insights or recommendations. Algorithms can range from simple rule-based logic to complex machine learning models, depending on the sophistication of the system. In some systems, they apply predefined clinical rules, e.g., if-then statements, to detect deviations from expected outcomes, while in others, machine learning algorithms may identify patterns and predict patient risks or conditions based on large datasets. Example: an algorithm might use a patient's age, medical history, and current symptoms to suggest the likelihood of a stroke and recommend immediate diagnostic steps. 2. Clinical guidelines. Clinical guidelines are systematic recommendations based on the latest evidence and research. These guidelines provide clinicians with standards for diagnosis, treatment, and patient care. CDSS relies on clinical guidelines to ensure that decision-making is evidence-based and aligns with best practices. The system compares the patient's data against these guidelines and makes recommendations accordingly. Example: a CDSS might suggest an antibiotic regimen based on current guidelines for treating a bacterial infection in a patient with certain characteristics, e.g., age, comorbidities, and allergy history. 3. Clinical guidelines in CDSS may be static, following established protocols, or dynamic, adapting to new research and real-time patient data. Integration of CDSS with EHR and other healthcare IT systems. Integration with EHRs. For CDSS to provide accurate and timely decision support, it needs to be integrated with the healthcare provider's EHR system. This integration allows the CDSS to access up-to-date patient information in real time, streamlining workflows for clinicians and ensuring that decision-making is based on the most relevant data. In many cases, CDSS is embedded directly into the EHR interface, allowing clinicians to receive real-time recommendations, alerts, and reminders as they enter patient data or review a patient's chart. Example: a physician reviewing a patient's chart within the EHR might see a prompt from the CDSS suggesting a change in medication based on a recent lab result. 2. Integration with other healthcare IT systems. In addition to EHRs, CDSS may need to integrate with other healthcare IT systems, such as laboratory information systems, LIS, pharmacy systems, radiology systems, and health information exchanges, HIEs. These systems provide additional sources of patient data that are crucial for comprehensive decision support. For instance, a pharmacy information system can alert clinicians about potential drug interactions, while a radiology system can share imaging data for more accurate diagnosis. Example: a CDSS integrated with an HIE might pull in data from a patient's primary care provider, hospital admissions, and specialist visits, ensuring that the clinical decision support is informed by a complete picture of the patient's healthcare journey. 3. Data. Interoperability. Interoperability between different healthcare IT systems is essential for effective CDSS. The systems must be able to communicate seamlessly, share data in a standardized format, and ensure that patient information is accessible across different platforms. In the U.S., the use of standardized data formats such as HL7 and FHIR, Fast Healthcare Interoperability Resources, has become critical for enabling interoperability in CDSS, ensuring that data from various sources can be combined and processed effectively. Example: if a patient is transferred between hospitals, the CDSS must pull data from the new facility's EHR system, incorporating both historical and real-time data to provide recommendations. 4. Real-time decision support. CDSS provides real-time decision support by analyzing patient data at the point of care and generating recommendations or alerts as healthcare professionals make decisions. The integration with EHRs and other systems ensures that this data is current, enabling timely and relevant decision-making. Example: if a clinician orders a new medication, the system can instantly check for potential drug interactions based on the patient's current medications and conditions, providing feedback immediately.